In regards to the main burden of disease in Nepal, communicable disease accounts for 30% of total death, while non-communicable disease accounts for 60% of all death. The top causes of death in Nepal include heart-related disease, influenza and pneumonia, and diarrheal disease. Of the three issues, heart-related disease causes 22% of all death in Nepal. Influenza and pneumonia accounts for 12.4%, while diarrheal disease accounts for 5.2% of all death. The main problem that leads to heart-related disease in Nepal is poor health facilities, health literacy, lack of trained health professionals, health access, and malnutrition. The main causes of high rate of influenza and pneumonia is due to the lack of clean water, malnutrition, and the lack of health education. Lastly, the high death rate of diarrheal disease is due to the problem of sanitation and water quality. With approximately a third of the burden of disease in Nepal due to communicable disease, first and foremost, a higher portion of the GDP must be invested into the health sector. Currently, only 5.5% of their GDP is invested, whereas a high-income country like Canada has a budget of almost double. Investment in improved sanitation will simplify the transition to cleaner drinking water. Attracting young people to education in the health sector should be of high priority, resulting in an increased number of nurses, doctors, and public health workers. Additionally, those with an even higher level of education can begin to develop vaccines. With access to clean water and vaccination being the two most important factors in the spread of diseases, the increased budget and support of workers will allow more people to understand the importance of sanitation, nutrition, and prevention of disease through the use of vaccines. An improvement in the understanding of the importance of nutrition must be paired with enhanced accessibility to a wide range of foods. With only 19.2% of the population living in urban areas, it should be of high priority to standardize the foods available to the Nepalese throughout the whole country. By establishing government-funded grocery stores, the disparities in nutrition between people living in urban and rural locations will be reduced, as they will not only receive the same education on the importance of diet and nutrition, but will also have access to the same foods. As they will be government-run, the quality of foods will be controlled and citizens will be able to purchase goods at a lower price. Although obstacles will have to be overcome for the local people, who still lead a very traditional lifestyle, even the simplest supermarkets will be able to provide an improvement in nutrition of the Nepalese, which will then translate in a lower burden of disease. To improve the sanitation, nutrition, access to healthcare services, clean water, and vaccinations, we are specifically targeting youth in Nepal. This group is often the easiest to reach and most willing to take part in actions. Furthermore, we hope to carry out a great deal of education on the prevention of some of the most prevalent diseases, which could reach the largest audience through teaching in schools, resulting in the greatest chance that the valuable knowledge on sanitation and nutrition could be passed on to future generations. There are many resources we will need in order to accomplish the goals we have set. First and foremost, we will need financial backing from the government. With a main focus on the country's youth, we will use a portion of funding from both our government and our worldwide organizations to target education on the importance of prevention and modes of treatment for the most prevalent illnesses. Finally, we plan to collaborate with different stakeholders, such as the member of the National Sanitation and Hygiene Steering Committee, regional governments, and healthcare agencies. With the support from a number of organizations and agencies from a variety of areas, we expect the sanitation problems and nutritional deficiencies can be improved.